if you have cortical atrophy of the brain? The submural space widens. So the same thing happens in the optic nerve. When you will have optic atrophy, here is the dura, and here is the dura, there is the nerve. You have a gap between the nerve and the dura is an indication you have optic atrophy. You've now made one diagnosis on the slide. It's okay? Yeah? Now, let me ask you another question. Another question is, how do you anatomically define, histologically, how do you define the macula? This is a very basic question for the residents. Okay, so I will tell you. They say, if you look at the ganglion cell layer, it's more than 2 cell layers thick. It defines the macula histologically. Okay? Now, I'm going to give you a question to which the answer is very well known, but I'm going to make it a bit more challenging and a bit more sophisticated for the residents who are here. And then I'm going to get more clinical for the practicing ophthalmologists. So forgive me, please, I'm going to talk to the residents for a couple of minutes here. When you take, in the United States, what we call the USMLE, United States Medical Licensing Examination, one question that's frequently asked of all the medical students, they will ask them, what is the most common cause of a cherry red spot of the macula? Now, what they're trying to do is they're trying to trap the medical students into giving an answer. It's a metabolic disease, Tay-Sachs, Niemann-Pick, and we know that the most common cause of cherry red spot is an artery occlusion. Now, it is frequently taught why you have the appearance of the cherry red spot. I will review this with you, but I have a different question because this audience is Israeli, so it must be much more sophisticated. My question is, what explains the difference in the clinical appearance of Tay-Sachs Niemann-Pick on one side and an artery occlusion? Think about it for just a moment. In the case of Niemann-Pick or Tay-Sachs, we know why you have the cherry red spot is because the storage material is stored in the ganglion cells. The ganglion cells are thick in the macula. There are no ganglion cells in the fovea-foveolar region, so the normal choroidal red color shines through. But the opacification of the retina is typically confined to the space inside the arcades, right? Inside the retinal arcades. But in an arterial occlusion, it's not just you have an opacification within the arcade, the whole thing is opacified. What's the physiological explanation? So, in a stroke of the brain, the patient has an infarct of the brain. Physiologically, what happens to the brain? I mean, why are you giving hyperosmotics and steroids? Because you want to reduce the amount of cerebral edema. An arterial occlusion is an infarct of brain tissue because the retina is an embryologic derivative of the brain. Therefore, the retina acutely swells. It creates an ophthalmoscopic opacification. Where the retina is the thinnest, in the foveola, okay, you see a little bit of choroidal color through, so that's the cherry red spot. But do you understand now the difference of why in an arterial occlusion the whole retina is opaque, whereas in the Niemann-Pick Tay-Sachs disease, it's only within the arcades. It's because that's where the density of the ganglion cells is thickest. Are we okay so far? Okay. Now, we know we have optic atrophy in this case. And there are many causes of optic atrophy. Glaucoma, could be chronic retinal detachment, but this retina is not detached, and many. Let's look to see now if we can figure out why this optic nerve is atrophic, and then go from there. So the best place to look is where you have the insertion of the inferior oblique, because that will take me to the macula. There's the insertion of the inferior oblique. I go to the macula here, and now we have a problem. Here I have the pigment epithelium, the outer nuclear layer, the inner nuclear layer, the inner plexiform layer. Where are the ganglion cells? So you said to me, well, Bob, you have a cell here and a cell there. Look, ganglion cells are supposed to be huge. These things look like, in Yiddish, a pintula, a little dot. Okay, it's not a ganglion cell. These are glial cells. Now, not only that, but what you see over here, or you have a thing here, a thing here, a thing this. These are the Mueller cells of the retina. They're normally present. You don't typically see them in a histologic preparation of the retina. The only reason you are seeing them here is no nerve fiber layer. No nerve fiber layer. Can you imagine? You don't need a retinal thickness analyzer, you don't need OCT, you don't need nothing. Now,